So now we have seen an overview of what comprises neurodiversity. Now moving on to what are the challenges these people face. So Ms. Sushma, do you want to say?
Yes, so we have spoken about different conditions, and now we are going to just break down the conditions and the issues or what they might face. For example, a person with dyspraxia, they might have difficulty with planning, okay, movement, or anything which might require a little bit more of the time investment. Dyscalculia, it's basically to do with math. So any number concept, any calculation, they'll have a problem. Dyslexia is basically to do with words. So there'll be problems associated with reading and writing. ASD, it's a huge spectrum. So anything to do with social and communication, they will have an issue. Tourette syndrome, it's any kind of physical or verbal tics that they might face. So all these, when it encompasses, different individuals might show different levels of difficulty. ADHD, so they can be either hyper or they'll be too focused. Again, the conditions are varied. So it depends from person to person.
How do you think they can cope with these challenges?
Okay. So it depends when it is identified. If it is early, probably the family can help with time management, being more routine oriented, schedule oriented, increased amount of creativity, initiating different kind of tasks, being more resilient, teaching a child to be resilient. When they become an adult, again the external atmosphere can be changed so that a little bit of positivity can come into the person, how the atmosphere treats that person, coming up with different plans, seeing to it that whatever shortcoming the person feels he or she might have, the person might not have actually but can feel they might have, how to help them with that can also help an individual.
So you're saying you can actually plan things ahead.
Yes.
Have some schedules.
Exactly.
Or sticky notes.
Yes.
Or if they're gadget friendly, they can
Yes.
have to-do list.
Yes.
There's so many things out there.
Basically,
If
yes.
they understand, they
Yes.
can work around
Yes.
their difficulties.
Exactly. It is just a point of being empathetic, being a problem solver, and being logical at the same time.
We've been talking so much about how they are different, what are their challenges. But we are saying let us include them, inclusivity. Do you want to elaborate on how we can utilize their strengths to work better?
Yeah. So the conditions that we spoke about earlier, a lot of them bring in a lot on the table in the workforce. So if there is a person who is on the autism spectrum disorder, they will have certain passions, certain interests that they are really passionate about. A person who's ADHD or attention deficit hyperactive disorder are naturally very creative people. They can naturally multitask and they can naturally be very, very innovative. A person who's dyslexic, having difficulty reading and writing, but are very good thinkers in 3D. They can almost imagine their products already being prepared in 3D. And somebody who's having difficulty coordinating their body movements or their physicality, they are very, very good at being good friends, right? So they're very sympathetic, they're very empathetic, they're very, very creative people. In popular fiction, we have a lot of examples. We have a lot of movies such as Tare Zameen Par. We have My Name is Khan. We have a lot of movies that have these neurodiverse individuals which came up with so many strengths.
So you're trying to say that even though they had strengths, they had challenges, they had strengths, and it doesn't mean that they are abnormal or we have
Yes.
to discard them away. We can,
Yes.
when we work together, we can use each person's strength. All of us are different. All of us have some traits of all these things. So we
Yeah.
can put them together and bring out the best in each other.
Yeah.
And in movies, when all this happens, we clap hands, we are so happy that they're included, we go watch it again, we spread it around. But when it happens in real life, why don't we do it? So that's why the movies are made, so that there's something that we carry away. And I think even Forrest Gump is one of those movies which encompasses this.
Yeah.
So when we go to a movie, sometimes there are messages that can be taken away, and this can be a part of it.
Sure. So, like, I think to sum up, we can say they're different. They are not less.
Yes.
So, neurodiverse individuals have their potential that needs to be reached during their development as
Yes.
children,
Yes.
as well as when they enter
Adults.
college and in the workforce.
Of course, yes. So we have spoken about so many pointers. Now I would like to ask, what are the risk factors or challenges that are associated with a neurodivergent individual?
One of the challenges is related to mental health
Yes.
issues.
Yes.
When they find this constant challenge of not able to do something or understand, they may feel left out or go back. So they may withdraw in within themselves. Sometimes it can come out as frustration. So that is external. They will show it outside. They are at a bit more higher risk of going into depression, having anxiety. It can affect their confidence or self-esteem. This is important for others around to understand and support these children. That is one of the challenges.
To add on, I think the other challenge that they have is underemployment or no
Of course,
employment
yes,
at all.
Yes.
Because though their intelligence is good, they might not even pass your interview stage at an organization simply because they can't be social, or they can't articulate what they are thinking, or they may not do too well in the written entrance tests that they have at organizations.
Of course, yes,
So underemployment or no employment is, I think, again one of the challenges that's present.
And to add on to that, I think even relationship challenges are something that they have to face. So we have, see, when we are talking about social interaction, it is inter and intra also. So they might have problem or challenges in addressing their family members, or how they might take them up. Challenge in making friends, peer relationship can get affected. So what's happening is, we are asking people to be sensitive. We are asking people to be sensitive to others, but what we see is people are becoming sensitive to themselves. So that gap has to be filled, and when these are addressed, not just a neurodivergent individual, even a neurotypical individual will benefit from that.
So you're trying to say, let us make it a normal
Yes.
thing. Let us put out our feelings to each other so
Yes.
everybody understands they go through similar things. So it is normal to go through it. We don't need to hide it and suffer
Exactly.
inside.
And be sensitive to others, not to oneself. So you be sensitive for another person, not for yourself. That's all. Yeah.